PKU is an inherited disorder of the body biochemistry in which patients are born with the inability to break down one of the normal building blocks of protein, an amino acid called phenylalanine. And as a result of that defect in being able to break down phenylalanine, the phenylalanine or Phe levels rise to high levels that are toxic in the blood and in the brain. If a patient with PKU never receives treatment, which was universally the case before about the mid-60s when we started newborn screening, what we see is severe mental retardation, often accompanied by seizures and behavioral problems. Fortunately, we now have treatment for PKU, so we're able to prevent those severe neurologic symptoms from occurring. Nonetheless, we see more subtle neurocognitive problems, learning problems, problems with attention, an increase in psychiatric symptoms, other symptoms relating from the effects of phenylalanine on the brain if patients are not in tight metabolic control. Well, traditionally, the treatment that we've had available has been dietary restriction of phenylalanine. So patients take in less protein, less phenylalanine, and the levels don't rise as high in the blood. The Phe-restricted diet is extremely difficult to maintain in the long term, however. I think anybody who's been on any kind of diet realizes how difficult it is to maintain for years. But at the same time, the Phe-restricted diet is even more difficult because these patients typically cannot have any meat, no dairy products, no grains, so no baked goods, no bread, pasta, rice. They can have limited amounts of fruits and vegetables, which are then supplemented with low-protein food products made by special companies, and also by a drink that contains all of the protein that they're not getting in the diet but doesn't contain any phenylalanine. So it is a complicated diet, and as a result what we find is that over the years, over time, particularly as we move into the older school age group, adolescence, adult life, it's very difficult for many patients to maintain, and understandably so. Unfortunately, in adult patients who have lost metabolic control and no longer are really under treatment, what we often see over time is that symptoms very slowly start to emerge. And because it is so subtle and the symptoms begin so slowly, often patients don't even realize that they're experiencing symptoms that could be related to their PKU. They may be not performing as well at work, or maybe not doing it as well at school because of problems with keeping their attention on the task, with the slower reaction time that accompanies high Phe levels, or they may start experiencing mood problems, a short fuse, some depression, anxiety, and not know that these symptoms really could be related to their elevated Phe levels. Many of the effects of phenylalanine on the brain are actually reversible. So if patients are able to get their Phe levels down again, get back in control, we very often see patients say, wow, I didn't even realize I was having symptoms until I got my Phe level under control, and now I know what it's like to feel good, to be able to really focus on a task, to perform at their peak in their studies or in the workplace. The other thing is we're learning that high Phe levels can have some effect also on other parts of the body. For example, we find an increased incidence of low bone density, osteopenia it's called, and even the more severe condition, osteoporosis, in young adults with PKU, and this is more common when the Phe level is not well controlled. Another very important reason is that in the woman with PKU, high Phe levels are extremely harmful during pregnancy, so that we want all of our young women who may one day want to have a family to have their blood Phe levels very tightly controlled, because we know that if they're high, this can cause very significant birth defects and problems in the unborn baby. And as we all know, pregnancies can be unplanned, and so we want to make sure that those women always have their Phe levels well controlled, so that if an unplanned pregnancy should occur, the baby would be protected. Not only do we have new dietary products, many new formulas, many new low-protein foods that make the restricted diet more palatable, but there is a new FDA-approved medication for the treatment of PKU called Kuvan, which lowers blood Phe levels in many patients with PKU. And we have other supplements like large neutral amino acids that can also lower blood Phe levels or potentially reduce the transport of Phe into the brain. So we have many things that we can do to help a patient, and because a lot of this is developed in recent years, many of the adult patients out there who lost contact with their clinic because they really couldn't maintain the diet anymore and didn't know that there was any more that could be done for them, really need to be aware that now we have so many more options. We've seen them become more successful on the job. We've seen patients return to school and get advanced degrees, or again form more stable social relationships. So as a result of that experience and seeing that change in patients who are able to get back in metabolic control, we've learned that, you know, it isn't an abstract concept, it's a real thing, and you really can see a dramatic change in your life